Welcome to Business Fortnight. Friends, as you know, the second wave of COVID-19 has been ravaging our country. Many people recovering from COVID-19 have of late been afflicted by black fungus or mucormycosis disease. The cases of this fungal infection have been on the rise in the COVID-19 patients in the last few days. Black fungus can turn dangerous if remain untreated, and it can also become fatal if uncared for. Today we have with us Dr. Amol Patil. He is a senior consultant ENT and skull base surgery at Nanavati Max Super Speciality Hospital, Mumbai. In this interview we will be discussing with him the cause of this deadly disease, its diagnosis, its treatment and do's and don'ts. Dr. Patil, our first question is, what is black fungus? I mean, how to identify it?
Mucormycosis is a fungal infection. It usually goes inside your nose and nasal cavity from the soil. So as you inhale this fungus, it goes and gets deposited in the sinuses. As it gets deposited in the sinuses, in certain high risk patients, it grows and can give rise to the variety of the symptoms.
Sir, can you please tell our viewers about the symptoms or the early signs of this disease, and when a person should rush to the hospital or the doctor?
So symptoms of mucormycosis depends on the area it affects and spreads to. As the initial infection is inside the sinus, the most earliest and the important sign is usually pain in your facial region. Facial region is a region of the nasal sinuses. So there is going to be intense headache, heaviness in the head, pain around the orbit, and there is a pain over the jaw as well. As it spreads to the surrounding structure, it involves the eye. As the involvement of the eye, it will give rise to redness, swelling, as well as in extensive cases, it gives rise to the vision loss. Next thing is, if it spreads inferior below the sinuses, it will go to the upper jaw. We call it as a palate. So when it involves the palate, there's going to be a blackening of the palate. There will be a loose tooth will fall, and patient will have pain while they swallow. Another very early symptoms of this infection is numbness over the cheek area. So this area of the cheek below the eye will have numbness. So loss of sensation in this area is one of the very earliest sign of this infection.
Please tell us about the treatment of this disease.
Treatment of mucormycosis basically involves multidisciplinary approach. So different experts from different fields like ENT specialist, then intensive care specialist, physicians who manage diabetes, and ophthalmologists if the eye is involved. In a very extensive cases, when it spreads to the brain specialists like neurologists or neurosurgeon also help.
How many black fungus patients have been treated in Nanavati Hospital so far?
Till now, Nanavati Hospital, in last 4 to 6 months time, we have treated 12 to 13 patients, and most of these patients we could save their life. Only one patient with a very critical infection going to the brain, who was already on the ventilator, succumbed to the infection. Rest of the patient were discharged after the complete course of the treatment.
Can you please tell us what are the procedures and surgeries are required to treat this disease?
Surgery usually involves the multidisciplinary approach. Initial cases with early infection will require removal of the fungus infected tissues from the body by the means of endoscopic surgery, which is performed through the nose. Along with that, we like to treat the patient with antifungal injections. these injection, the molecule is amphotericin. So these injection also needs to be given for little longer period, say 3 to 4 weeks time. As well as the most of these patients are diabetic patient whose immunity has gone down. So their sugar control and monitoring of the blood sugar levels are very important. As this disease involves eye or the jaw, the specialist which take care of these areas are also involved, like ophthalmologist. When it involves the brain, neurologists and neurosurgeons also help in treating this condition.
Sir, what would you like to advise our viewers?
Message is pretty clear. Prevention is better than cure. So how you can prevent it? You are using the mask. Okay. Second important thing is they're called as wash to the nose. So these we call it as nasal douching. So nasal douching is nothing but washing away your nose and sinuses with a saline spray. So there are readily available kits for the nasal washing available over the counter, which doesn't have side effects. It helps cleaning your nose and sinuses better, and this avoids fungus getting deposited in your sinus. This can be performed daily without any side effects. Third important thing is giving importance to the early diagnosis. Fourth important, any diabetic patient with post-COVID treatment should consult a specialist with any of the early symptoms. The most important message from me is that if diagnosed early, this condition can be cured. So there is a cure available for this condition. There are definitive medicines available, definitive surgical options available. So most important part is early diagnosis and definitive treatment, and patient can be cured.
Dr. Patil, thank you so much for sparing time and joining us. Thank you so much.